So the first rehab exercise that I'm talking about would be for phase one. It's going to be a pendulum exercise, which is going to address for us our decreasing in pain and inflammation, and we're going to also try and regain some range of motion pain-free. So what you're going to do is have your arm down, injured arm hanging, just swinging 10 to 20 times based on tolerance, forward and to the side. 2 times around, 20 or so reps apiece, moving in about a second per rep. So the second phase one exercise we're going to address here is isometrics, specifically an abduction, because early on after a slap repair, you're typically not going to want to load the biceps or do any sort of serious rotational components to your shoulder when you're doing rehab exercises, just because that tissue is healing. So for an isometric, the goal here is just to prevent any muscle atrophy and regain some basic strength at the beginning and range of motion. So in this case, because we don't have an ideal environment, we're gonna have our arm down. This is gonna be our barrier, and we're just gonna be abducting isometrically against the table, holding for 3 seconds, then relaxing. Isometrically contract, hold for 3 seconds, relax. Ideally, we do this 3 sets of 10 or so, trying to do some fatigue, some muscle contraction, and just maintain that muscle tone and prevent atrophy. Phase 2 exercise we're going to do is going to be just active external rotation of the shoulder, of the affected shoulder. We do this in phase 2 because we first want, before we move on, full passive range and for the most part, pain-free at rest. So the goal of this is just to reestablish some muscular strength and muscular contraction, and then work through a full range eventually. If it's too easy standing, I'm going to show you in a second a variable that you could do prone, which will add a little resistance due to gravity. So to start, you'll be standing, and it'll be as simple as externally rotating out. Now, if the patient's having trouble getting to this point or feels tightness, we can also add a dowel, externally rotating out. If this is too easy for the patient, we're going to have them laying down. And for the sake of a demonstration, I'm going to use the shoulder rather than the affected shoulder. You're going to be down, rotating out. Down, rotating out. And by doing that, we're adding just a little bit of gravity resistance and maybe progressing them from that standing position. The phase 2 exercise we're going to do is scap squeezes, and basically this one is going to address regaining any normal arthrokinematics in the joint. So obviously we know our shoulder girdle, we need our scapular mobility and stability so that we get proper functioning distally. When you get a labrum repair, everything tends to be, disoriented, tends to be stiff. Neuromuscular control is obviously down. So with this, we're just trying to regain some scapular mobility and retrain the muscles that move the scapula to work properly. So what we're gonna do, and this is the most basic variation of it, we can advance this in many ways, but similar to the external rotation, we're going to be standing, and when we talk to the patient, we're going to be telling them to squeeze the center of their scapula, squeeze toward their spine. So we squeeze back, make sure that there's no winging in the patient, and then we squeeze forward. Squeeze back, and squeeze forward. To advance this, to make it a little bit more difficult, we could add resistance bands, or we could use, again, prone lying resisted due to gravity. And then what we're looking for as clinicians is the scapulas being flat against the back and avoiding any winging. All right, on to our phase 3 and phase 4 exercises. So at this point with our athlete, we're trying to progress them back to a functional level, and we want to make sure that their body is ready to accept the demands placed on them when they're performing functionally at their highest level. So at this point, a lot of maintenance will be based on stretching of the capsule past a comfortable zone and regaining it back to your pre-injury level. So the first exercise that we're going to do for our phase 3 is called the sleeper stretch, and this is going to be a capsular stretch that the patient can do at home or in clinic, wherever he feels fit. And the goal of this is just to regain capsular mobility, separate that posterior capsule from the scapula a little bit from the glenoid. So we're going to be on our side. Affected arm will be down. And this is going to be especially effective in throwers that are recovering from a slap tear because they need that range of motion in their shoulder. So side lying, patient grabs the arm with the unaffected arm, and we'll just be rotating down while keeping the shoulder depressed and not letting it shrug upward. So we're keeping our shoulder depressed down, patient pushes as tolerated, and we're looking for a stretch in the posterior capsule in the back of the arm. All right, so our last phase 3 exercise we're going to do is going to be D2 into flexion. So for throwers specifically, what we're going to be dealing with toward their return to play is a weakness with their decelerating musculature, meaning their supraspinatus posterior delt and their rhomboids and mid-trap. What these muscles do in the throwing motion is during the follow-through, they're activating to literally decelerate the shoulder as it comes through. And in pitchers, what you get is guys throwing 70, 80, 90, 100 miles per hour. That is a lot of stress on those decelerating muscles to prevent any further injury or prevent that excessive motion. So what we're going to do with this exercise is be in our throwing stance, and we're going to start with our shoulder internally rotated, adducted, and extended. And from here, what we're going to do is abduct, externally rotate, and flex the shoulder. Back down, abduct, externally rotate, and flex. Abduct, externally rotate, and flex. So in doing this, what we're trying to do is retrain that motor pattern, first of all, for those decelerators, as well as regain some neuromuscular control in that pattern moving through. Because without that neuromuscular control, you really risk re-injury and further complications as you return to play.